26 bowls of chips. Mouthful chips. You can download from the LBC app, the Global Player, or wherever else you get your podcasts, as well as listening live to LBC. Listen back to this and other LBC programs on the app, as well as listening to a range of podcasts. Just go to lbc.co.uk. It doesn't cost you any money at all. You'll do it very quickly and very easily. It's not too complicated, I promise you. Then you can start downloading like Shane and like hundreds of thousands of other people as well. So I'll join the merry band and download as many of the programs as you can. I'll be back with you tomorrow morning at 4. Have a great day. Wrap up at 10. It's Imagine Hours. Next, with breakfast on LBC, it's Andrew Castle.
Steve, good morning. Thank you very much. A record number of people are being treated for coronavirus in hospitals in England. Yesterday, the number of new confirmed COVID cases surpassed 40,000 for the first time. This is the NHS Chief, Sir Simon Stevens.
Now, of course, again, we're back in the eye of the storm with this second wave of coronavirus sweeping Europe and indeed this country.
And this morning we'll speak to hospitals in London to find out how they're coping. In Europe, the EU ambassadors have unanimously approved the UK-EU post-Brexit trade deal, and in Switzerland, the British have escaped.
We can guarantee that it's not all people escaping from holiday. Most of the people just respect the quarantine or went back using the normal process.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 7 o'clock. Around 1,500 members of the armed forces are going to be drafted in to help support COVID testing at English schools. The government's facing growing pressure to abandon plans to reopen secondaries in January. As it stands, the staggered return will see all primary pupils and year 11 and 13s go back next week. But teaching unions have warned allowing pupils to return will put them at risk of catching the new variants of COVID-19. Emma Parker is from the National Education Union.
I personally don't believe that it's a safe option. I think what we have had is we've seen the new strain come out, and we've seen a massive increase in cases in both secondary and primary in our area. And for the first 2 weeks, our students should be doing online learning.
Health bosses are warning doctors and nurses are back in the eye of the storm as England's hospitals now have more COVID patients than in April. Figures show more than 20,000 people are currently being treated. There's growing concern the new, more contagious strain of coronavirus is putting too much pressure on the health service. The head of NHS England, Sir Simon Stevens, says it's been the toughest year in memory for his staff.
We've been responding to the worst pandemic in a century. Many of us will have lost family, friends, colleagues, and at a time of year when normally we would be celebrating, a lot of people are understandably feeling anxious, frustrated and tired.
More than 41,000 COVID cases were recorded in the UK yesterday. It's the highest daily number on record. A 30-year-old woman has been charged with the murder of a 4-year-old boy in southeast London. The child was found dead at a flat in Plumstead yesterday morning. The suspect, who is related to the boy, was arrested at the scene. Labour leader Sir Keir Starmer is facing a high-profile revolt over his decision to back Boris Johnson's post-Brexit trade deal. EU ambassadors approved the agreement yesterday, and MPs here will vote on it tomorrow. The former Shadow Chancellor John McDonnell and ex-Cabinet Minister Ben Bradshaw are calling on opposition parties not to support the agreement. The SNP, the DUP and the Liberal Democrats plan to vote against it. Some parts of the country could see temperatures as low as minus 10 degrees today. Drivers are being urged to stay off the roads as more yellow weather warnings of snow and ice are in place for England, Wales and parts of Scotland. In the city, the FTSE 100 will reopen later at 65.02 after closing up 6 points on Christmas Eve. The pound buys $1.34 and €1.10. The weather, inland areas mostly staying dry with sunshine but feeling cold. Wintry showers on the coasts and a band of rain, sleet and snow moving south across England, Wales and parts of Scotland. A high of 6 degrees. From Global's newsroom, I'm Holly Harris.
Hi there, small business owner. Your tiny, hard-nosed QuickBooks team here. We know you've got better stuff to do than looking after your tax, invoicing, payroll, mileage tracking, and everything else. So let us take care of it. That's right. We're an entire business department taking care of the finance stuff. 27 hours a day, 8 days a week. So you can lose
said yesterday. It really doesn't. I mean, that's a direction of travel. Things seem to be changing every 24 hours, so we'll completely update you on what is likely to happen with schools. We understand that some military personnel are going to be drafted in to help with the testing. Just 1,000 people at the moment. We were talking about that yesterday. I mean, that has to be a good idea. It's just all hands on deck, isn't it? And what about these poor kids who are taking exams this year? Do you think school should be going back? If I was a teacher, I wouldn't want a bunch of 13, 14, 15, 16-year-olds in front of me. They're mixing out of school, in school. Very, very difficult to social distance. We'll address that issue a little bit later on. Let's just talk about the central and nub issue now, which is NHS and the hospitals. Again, desperate situation, more people going in, and people are getting very ill, and we just can't afford not to have a health service at the moment. I can't Institute of Intensive Care Medicine. In a minute, I'll speak to the leader of Epping Forest District Council, but first, Professor Singer, the situation where you are, if you please.
Yeah, good morning. Not bad. Things are, we're 50% above our usual capacity, and the trajectory is just shooting up. So, we're back to where we were in the spring, unfortunately.
People say, I ventured back into the world of Twitter very delicately yesterday, because I went off quite some time ago. Because there are so many people who are saying, what about the Nightingales? Why were they built in the first place? It's always like this. Every year we hear the same thing from the NHS every single year. And actually, intensive care pressure is no different this year than any other. And yet, we're destroying the economy, the livelihoods of people, jobs are going and all the rest of it. So, could you speak to those people who really, they're not getting the message about the NHS yet? They can't understand this. And there's many of them.
Yeah, I think unfortunately it's 100% completely misguided. I've been doing intensive care for 30 odd years. I've never seen anything like what we're experiencing at the moment. Yes, there are winter pressures, things are tight, elective surgery has to be cancelled, but now we have this sort of double whammy of sick people who don't have COVID and this huge surge of COVID patients who are incredibly ill and compounded by a lack of staff. So a lot of staff members are going off sick and either having to isolate or there's a huge amount of burnout and stress. So it's completely unusual.
And after people have major operations, there's nowhere to recuperate, as I understand it, and therefore some of them are being cancelled. Nowhere that is COVID secure, that is.
Yeah, absolutely. So we're trying our best to keep going with the major cancer surgery, for example. Obviously, emergency surgery has to be performed, so that has to be squeezed in on top of the surge of the tsunami, as you called it earlier, of COVID patients.
Yeah. Regarding the Nightingales, could you speak to people about that? It looks like the one in London is being dismantled at the moment. Why do you suppose that is?
Well, I think it was never, from my point of view, as it were, fit for purpose as an intensive care unit, because it's not just the equipment, but you need the staff, and we normally have a ratio of 1 nurse to 1 patient for intensive care. In the spring, we were operating at 1 to 4, and clearly, if you're going to open up huge numbers of beds elsewhere, you've got to staff them somehow. So we were struggling to maintain our normal standards. Where were we going to get the people from to staff a whole load of extra beds? So it was, to my mind, a non-starter in the first place.
And now, of course, the ambulance service. I know this is not directly your area, but you are in the centre of the service. But the ambulance service, paramedics, they're describing situations where they're treating people in the wagon rather than taking them in because hospitals can't accept. Have you seen that as well?
Well, not where we are, thankfully, at the moment. Obviously, everyone, there's a huge amount of networking and support mechanisms going on to try and prevent these decompensation. So, unfortunately, some hospitals, especially in the periphery of London, are really struggling where huge numbers of patients are just piling up at the front door. So I think it's a bit easier in central London, but it's still bad everywhere.
And you're heading off to work this morning, are you, Professor Seal?
Yeah, 3 minutes and off to work.
I did get a note about that. Are you all right at the moment? How are you doing?
What, me personally?
Yeah, how are you doing? How are people coping who are working in this environment?
Well, I think luckily we have a very cohesive, strong unit, and we're all working together really well, and we're helping each other. So there's a lot of internal support, and again, I think we realise that we're in it. It's not a sprint; it's a marathon, and it's going to be like that for a few months. We're trying our best to bolster each other's morale.
Well, it's much appreciated by the vast majority, and I think understood by most as well. Have a good day at work then, Professor Mervyn Singer. Thank you, Professor of Intensive Care Medicine at UCL. It can't be more straightforward than that. You just heard from somebody who's about to go and work once again in this environment. Don't tell me that we can't afford a lockdown. We can't afford not to now. You call me a turncoat. That's 03456060973. What is the situation in terms of dealing with the public and trying to run a council? Councillor Chris Whitbread is the leader of Epping Forest District Council. He can tell us about this. Hi Chris, good morning to you. How much pressure are you under at the moment and how concerned?
Yeah, morning Andrew. I'm really concerned. Epping Forest on the end of the Central Line has figures of 1,388 over 100,000, so we're one of the top 3 places in the country for the COVID infection, so it's really worrying at the moment. And I think the toughest thing is getting people to understand it. You said it in your earlier interviews. It's getting people to actually understand that we are still in a pandemic, and it's...
People are sick of it, Chris. They're absolutely sick of it. They're sick of the worry. They're sick of watching their children panicking. Still waters run deep, was the way one parent described a fairly quiet child who isn't quiet recently to me here. And people are worried about the future. And so, you know, if it hasn't affected them directly, if they're not seeing what you're seeing and what Professor Singer is seeing, you know, they just don't get it.
Yeah, and I understand that. I mean, I'm with them. I'm a small business owner as well, so I get it. You know, I understand the worries. I sat here back last March worried sick whether or not the 10 people who work for me will still have jobs at the end of it all. So I get it. I really do understand it, and I feel really sorry for all those businesses that are closed at the moment, and I worry for parents as well with their children going back to school.
Yeah, what's the story with that? Are you speaking to central government, or are you waiting to be told what to do? What's your involvement with the local schools?
Well, remembering as a district council, we're not responsible for education, but obviously we'll be listening to government advice. I have to say we've worked really closely with Essex County Council and Public Health England and our figures locally in the messaging. But as I think personally the key thing is to still get across to people, especially with the fact that we're in Tier 4, is where possible, stay home. Avoid the hospitals, take the pressure off them, because they've got the winter pressures, as you just heard, on top of the COVID pressures.
Yeah.
And if you can access hospitals through any other source, online or any other way, please do, because we need hospitals operational. I've got family who work in the NHS, so again, I know the pressure they're under at the moment.
Have you got children as well, Chris?
Well, my two are 27 and 23.
Well, they're still children. I've got some of the same vintage, but okay, so you're not sending them to school.
And the impact on them, even at that age, is incredible, isn't it? Because they're not having their young lives anymore. They're sitting there. I was going to say they're sitting at home, but they're not. My daughter's a district councillor as well. But we're all trying to get on with our lives. My son's doing teacher training, so I get it. I see it.
What does your son say? You might not want to quote him because he might hit you, but does he think, as a trainee teacher, that schools should wait to open? Do you think they should remain closed whilst the testing regime is sorted out?
Andrew, if I'm honest with you, I think for anybody that there's stress there. If you're on the front line doing that type of training at the moment, there's stress there. But first and foremost, he's focused on getting through and becoming a teacher. And so he's but I've got the staff who work for me who've got children at school, and I can see the worry etched on their faces as well. So it's this ongoing concern, isn't it? Because actually, all we all want to do is protect our families.
That's right. Councillor Whitbread, listen, I've got to let you go because I've got to head to the news. It's really good speaking with you. I wish your business well, and I wish the people of Epping Forest well. High infection rate, well, 100,000 there. We've heard from Professor Mervyn Singer about the situation in hospital. You've heard from people who work in the ambulance service, people who are working on the front line. Countless people. Okay, maybe the question is, do you not want to save the NHS? Do you not understand that if you get sepsis, or if you have an aortic bubble that looks like it's going to burst, you're going to need emergency care? It may not be there if COVID-19 continues on the trajectory that it's going over the next 2 or 3 months. Do you not understand that? 03456060973. Or Latin, the EU deal. We'll talk about that next. What a busy time. And the news with Holly Harris.
The MOD has confirmed 1,500 members of the armed forces are going to help with mass coronavirus testing at schools and colleges in England. There are now more COVID-19 patients in hospital in England than at the peak of the first wave of the pandemic in April. The Labour leader, Sir Keir Starmer, is facing a high-profile revolt over his decision to back Boris Johnson's post-Brexit trade deal. The weather cold with spells of rain, sleet and snow, a high of 6 Celsius.
LBC Travel, I'm Anne-Marie Walsh in Croydon, and Park Lane is closed in both directions between Lansdowne Road and the Croydon flyover because of a fire in a building. As a result, there's no service on London Tramlink between Reeves Corner and East Croydon. On the A13 westbound, one lane remains closed between the Beckton roundabout and the Beckton flyover. That's for emergency repairs. On the tubes, no service on the District line between Turnham Green and Ealing Broadway. And on the trains, because of engineering works, there's no services operating in or out of King's Cross.
LBC.
This winter, Barclays has partnered with FareShare to help people struggling to put food on their table. So, for every £1 you give to FareShare through us, we'll give £2 more. Up to £1 million from us. To help put food on a plate, text give 5, give 10, or give 20 to 70630. Or search Barclays FareShare. Text costs £5, £10 or £20, plus the standard network rate. Donations matched until the 28th of February 2021.
This is LBC.
London is in Tier 4. Stay at home. 1 in 3 people who have coronavirus have no symptoms and will be spreading it without realizing. And now there is a new strain of COVID-19 which spreads even faster. To protect each other and help stop the spread, only leave home for food, medical reasons, exercise or work. Do not travel unless necessary and work from home if you can. Go to gov.uk/coronavirus.
Right, car needs a clean. Finish my cuppa first. Of course, the sponge is on the top shelf in the garage. Don't want to drag the steps out just for that. Check weather. 2% chance of snow. Maybe next weekend.
Don't put things off this year. Get 6 months free data and calls. So the Samsung Galaxy S20 FE is now under £16 a month. Get your skates on. Search Auto Winter Sale.
£15.81 for the first 6 months on the 1 gig custom plan, then £31.81 a month plus RPI ends 30th of January.
Co-op Car Insurance presents The Switch. Some switches are more difficult than others, like the switch from 49 to the pay 50, compared to switching to Co-op Car Insurance, which now includes protection of your no-claims discount if involved in an accident with an uninsured driver. Plus, if you buy before March 31st, you'll get a £50 Co-op gift card. Search Co-op Car Insurance and make the switch. Underwritten by Zenith Insurance PLC, uninsured driver promise on fully comprehensive policies only. Full T's and C's at co-op.co.uk/insurance offer.
At Battersea, we've learned a lot about dogs and cats in the last 160 years. Marvellous Moggies, stupendous Spaniels, terrific Terriers, and so many more have benefited from our care and expertise. But at the end of the day, rescue is our favourite breed, and we're proud to be always open to any dog or cat that needs us. So if you need Battersea support to find your pet a new home that's right for them, one of our centres in London, Windsor or Brands Hatch will be happy to help. Visit battersea.org.uk to find out more.
The Central London Congestion Charge and the ultra-low emission zone are now back in operation. NHS Trust and care home workers may be able to claim congestion charge reimbursements for work journeys. Some NHS patients may be able to claim congestion charge and ultra-low emission zone reimbursements from their participating treating hospital. For information on the hours of operation and eligibility criteria, search TfL driving. To the Mayor of London and TfL, every journey matters.
Andrew Castle on LBC. Call 0345 6060 973.
And a very good morning to you. Exactly what part of please wear a mask? COVID is a lethal airborne virus. Cannot some people understand? Says Richard in Knightsbridge. Well, no, I do understand. There's plenty of you very, very angry when you see that. Have you seen that in your sort of real life? Whether you're travelling, walking, exercising, whatever you happen to be doing, are you seeing people not wearing masks? I mean, if you're going into a supermarket, are people still not wearing? Because I rarely see people who fail to put the mask on. I mean, it's socially unacceptable now. You don't smoke on a bus. You used to smoke on airplanes. You don't do it anymore. I don't see it much. I know Sheila gets extremely upset with it, and people do. Even walking around outside, you see some people, they've got fear in their eye. I mean, are they right? Or are those who are saying, well, nobody's going to tell me what to do right? I mean, I know which way I come down on this argument. 0345 6060 973. Let me just take you through